And so I want to take less than 1 minute to demonstrate how to properly put on and take off a mask and talk about the important things. So the most important thing is washing your hands. So before I get my mask and put it on, the first thing I'm going to do is wash my hands. I don't have that available here, but I would do that with either hand sanitizer or soap and water actually is probably the best. Then I'm going to get out my mask, whether it's my nice new hand sewn one that someone gave me or I have actually a surgical mask that we use in the medical setting. And I'm going to take my mask and I'm going to put it on. And so I'm going to do that. And I'm going to fit it the way I should. And now once I have my mask on, I'm going off to do my job. As a healthcare worker, we're requiring all of our healthcare workers to wear this all day long with the interface with patients. So I'm putting this on and I'm not taking it off. I'm doing my job, I'm washing my hands frequently, I am not touching my mask. Remember, this mask is to do two things. It's to protect you from droplets or aerosolization in the air. And if you're a asymptomatic carrier, it's preventing me from coughing or talking and aerosolization coming out that could infect somebody else. So this is a filter just like you have in your furnace. When I go to take it off, remember it's a dirty filter. Don't touch it. The most important thing is how you don't touch this mask once you get it on and what you do with it afterwards. I've seen people in the grocery store wearing it around their neck, wearing them on their forehead, pulling them away from their face to talk. They're grabbing the mask. So if you just touch something and your finger's contaminated, think about grabbing your mask. Now it's in your mask and against your face. So when I take this mask off at the end of the day or at my time when I need to change it because it's getting moist or whatever it is, the first thing I do is wash my hands. So I have clean hands again. Then I simply take the mask by the straps and I do not touch the mask. And now I can set it aside, and you can reuse these, you can launder them, but the important thing is this is now contaminated. It's contaminated on the outside from the guy in the grocery store I walked by that had a little cough that I wasn't aware of. It's contaminated by myself on the inside if I'm a silent carrier of this virus. And I want to protect myself and my family. Don't be touching the mask. Don't be wearing it around your neck. Don't be putting it on your forehead. Wear them appropriately. And there's information online. You can read about the proper use, proper laundering and cleaning of the sewn masks. These are for our protection. Use them appropriately, just like your seat belts in your car. They do no good if you're not using it the way you should.